Hey guys, so I just want to come by and tell you about my most recent webinar on interview preparation for the IMG. It's a 60-minute webinar with additional information as to how you can make yourself sound good and create likability during an interview. You can find it at imgroadmap.com/p/interview prep. The link is in the description box. The IMG Roadmap is the only podcast dedicated to coaching international medical graduates in success blueprints for this unique pathway. I am Dr. Nina Loom, your host, a previous IMG turned hospital medicine physician, healthcare administrator, speaker, and coach. I empower, encourage, and equip you with actionable steps that you can take towards the residency position of your dreams. Hey guys, welcome to another episode of the IMG Roadmap podcast. Today's guest is special. Okay, we don't get a lot of surgeons around here. This is probably about maybe our second or third surgeon on the podcast, but I would like to introduce you to Dr. Chauhan. Dr. Chauhan, welcome to the podcast.
Hey everybody, my name is Ishit Chauhan. I'm one of the general surgery prelim interns at Jackson Memorial Hospital. It's affiliated with University of Miami. How's everybody doing?
Oh, I'm sure if they were here right now in this room, they'll tell you they're doing all right. They want to hear all about the prelim surgery match, I'm sure. So tell us a little bit about yourself. Like, where are you from? What country? Where'd you go to medical school?
So I've traveled around a little bit. I'm originally from India. I did my high school in India. Then I moved on to China to do my med school. Then at some point in time, we're supposed to do an internship in for all the people who have graduated from schools from outside the US. Say, for example, many countries have like a 6-year format, right? So we're supposed to do an internship. For my internship, I went back to India to do my internship. At that point in time, I decided that I want to do my steps, and, kind of like move into practicing in the US as a long-term thing. And that's when I really got into like the steps. I started giving my steps, started doing my electives. I liked it here when I did my electives. It was a completely different experience when I was doing my electives, and that pretty much set my focus as to what I wanted to do. It was to match in US, and then surgery was something that I loved, and to be able to match into a general surgery position was something unprecedented. Like, it was something that I really, really wanted. I wanted it more than even say internal medicine, which I also applied for. But yeah, so I have my foot in the door, and now I'm like really excited with almost 1 month of residency under my belt. I'm really excited to just, make sure that I do my best to get into a categorical position, and then, hopefully become a surgeon one day in the US.
Yes, that's so remarkable. That's a remarkable story right there. So you've told us so much great stuff. Let's go back a little bit. Can you tell us what province in China, what school you went to, and the year that you graduated?
Right. So I went to Jinan University in Guangzhou. Guangzhou is like towards the south of China. It's like the third or the fourth biggest city in China. It's pretty close to Hong Kong. I graduated in early 2019.
Okay. So, and when you graduated in 2019, then to complete your intern year, you went back to India to do that.
No. So just a little rewind there. What happens is that in order to graduate, you also have to complete your internship. And my university does not have a restriction as to where I do my internship. I could have done it, say, for example, in the US, I could have done it in India. It was after I completed my internship in India that I finished my graduation in China.
Got it. So this was part of your curriculum to do the
Yes.
internship. Understood.
Yes.
Okay. And so then while in India, did you take all of step 1 and step 2?
So it was towards the end of my internship that I started with the step prep, and then I took my step 1 in India. It was last year during, I think, August 2019 that I applied for step 2 CK. I mean, I took step 2 CK. And during my electives back in 2018, when I was doing my electives, it was at that point in time that I took my CS. So it was step one, CS, and then CK, and then application for the match.
So over a span of maybe 2 years, you took all the exams that were needed.
Yes. Yes.
Okay. But you actually did something different. You decided to do the exams while still a medical student, even though it was during your internship year. Why did you make that decision?
So I was essentially trying to make a decision as to what I wanted to do. I was interested in practicing, like I was interested in surgery, but I also wanted to do it in a different place other than India or China. One of the options was the US. I was looking at UK at that point in time as well, but then one of my mentors essentially just nudged me towards USMLE. He said that if you want to practice, go practice in like probably what is considered the best medical system and what the whole world essentially looks at for whenever health is considered, and everything is like considered. This is where everything happens. Like
Right.
FDA is over here, the NIH is over here. This is where all the latest research goes on. This is where all the new technological advancements in medicine happen. And he's the one who essentially like nudged me towards that. And he's like, go ahead, go pursue USMLE.
Wow. Yeah, that's good. It's always good to have a good mentor, behind you. That's really great. So, can you tell us a little bit more about how you performed on USMLE, having been that you studied outside of the US, didn't have, you hadn't necessarily gone to school here or did rotations here, but you were able to study outside the US. So, can you walk us through, what your study prep was like? If you want to share your scores, we'd be more than happy to know that because, we're nosy.
Sure. So it was midway through my internship that I started preparing for my step one. It took me around, like, I would say around 8 months. After I finished my internship, I had a downtime of around, like, maybe around 5 weeks just to have a really focused studying time for step one. Eventually I performed. One of the biggest things that happened was like my elective was scheduled like one day before I actually took my flight to New York for for the said elective. So I didn't want to delay my step one and take my step one in US and be in the middle of an elective while I'm taking the step one. So at that point in time, I just took my examination. The very next day I flew to New York. And it was like during I was doing a presentation during my elective, and I still remember like it was during the grand rounds. I was doing a presentation, and I come back to my seat after the presentation, and my phone's right there. I open it up, that email that says that your scores are available was right there. So I scored a 232 on step one. Again, it wasn't the greatest score, but it did set me up in the sense that, again, like essentially like got my foot in the door. Like that was the
Right.
first step. And many of times people ask me like, hey, my score is so and so, and I'm sure you must have had these questions wherein like people are like, oh, my score is so and so, should I still pursue it, should I not pursue it? And
Yeah.
at that point in time, maybe I had the same dilemma, but like I was like, I've already done it. Like I'm in the middle of an elective, I've already scored, I have my step one behind me. Let's
Yeah.
just push on, let's just do it. And then after like a couple of electives, I did my step 2 CS. And then I went back to India, finished my graduation, and I started working for some time in a hospital in India as a junior resident. It was during that time, that was 2019, and I started preparing for step 2 CK. For CK, I would say that it took me a little bit longer in the sense that because I was working at that time, I was also involved in a research at that point in time within India itself. And then I started preparation for CK. And I feel that CK also is a little bit broader than step one. So When I eventually took my step 2 CK, I got a 226. Again, I was just around the corner from the application last year. So I just hustled through and, applied for both internal medicine, essentially like a backup, and then a general surgery categorical and prelim positions as what I actually wanted.
Right, right. So we'll come back to talking about how you ended up getting into the preliminary position for general surgery, and I'm confident that you'll get a categorical spot. But going back into your story, I'd like to highlight certain things because IMG's listening sometimes. They're grasping at all the information, but I really want to just pinpoint some things that I'm identifying in your story that really I think other people can copy and get, good results. One is, you started preparing for USMLE while still in medical school. I do believe that that's a great way, a great strategy to use as opposed to waiting until graduation and then taking an excessive amount of time off to sit down and study when you could be studying simultaneously. Two, the next thing that I think, you did was you set up those electives while still a medical student. What a lot of IMGs don't realize is, and for everybody listening, if you are still in medical school anywhere in the world, you have a much better option of getting some really good quality electives where you can actually present a ground rounds report like Dr. Chauhan did. And that goes on your ERAS application that you did that presentation. But you will be able to get opportunity like that where you can get more what we call hands-on learning if you are still enrolled in medical school. Once you get out of medical school, then it gets a little bit tricky because then it's an observership and there's so many strings attached to that experience as opposed to an elective, which is incorporated in your usual medical training. So I really think you did some things that other IMGs need to copy from, and they can probably learn and be inspired by, because here you are from China, well, from India by the way of China, and back to India, but then starting a plan early. That's another thing I was going to say. You had a plan and you started early. You had a mentor, you had somebody guiding you, but you took action and you started early and you started to chart the territory. I think a lot of IMGs spend more time thinking about starting than they do with actually starting, right? Like you spend more time just wondering about whether to do it, whether not to do it, than just getting in the mix and doing it. And just so many inspirational points for all the listeners that we can all learn from Dr. Chauhan's story today. Dr. Chauhan, so kind of back to you. I always go off in tangent like that when I start speaking because I'm like, I wish people would just see other people. Like, the reason I share success stories of IMGs is because I want people to see, like, it's one thing to tell them something, but it's another thing to show, right? And so when you
Yeah.
show somebody something, you hope that they actually see what you're seeing. And so that's why I take some time out to just kind of repeat everything you said to make sure that the audience is actually seeing what I'm talking about. So let's go into how you applied and, maybe even tell us a little bit about the difference between a prelim and a categorical. Because you have some people interested in surgery that are scared because, they're being told it's competitive, it's surgical, you don't stand a chance. Can you just talk to us a little bit about that process, what that meant, what that was like for you making a decision about applying to both categorical and prelim?
Right. So on the ERAS application itself, when you apply to a surgery program, you apply to the program. So say, for example, University of Miami, Jackson Memorial, the place where I matched, they have prelim positions. They also have categorical positions, right? So it's not a separate application for both. It's a single application that is sent to the program. If you choose to apply to that categorical program only, that's your decision. If you choose to apply to the prelim program only or both, again, that's your decision. So that's one thing that right off the bat needs to be clarified. Another thing that people do ask me is as to what is a prelim position. A prelim position is essentially everything that the first year position is just that it's only for 1 year. So think of it as say, for example, general surgery. So you need to have 5 years of ACGME accredited training to be able to become a board certified general surgeon, right? So a prelim position is only 1 year of those 5. How you go about, after you're done with your prelim year, there are 3 essential options. So the most ideal condition is that after your prelim first year, you match directly into a categorical second year. So essentially, you don't lose any time. You just move on from your first year, which was prelim, to a categorical, and you just continue the rest of your training. Something else that might happen is you might match into a categorical first year. And that means that you're going to have to repeat your first year. But again, because you're in a categorical position now, you can just go on and finish your training and be ACGME accredited and board certified eventually. The third option is that after you do a prelim 1 year, many institutions also offer a prelim second year. So that's also something that, say, for example, if you don't match through the NRMP, there are some off the match positions available for hospitals, especially big hospitals that require the workforce, but don't essentially take the resident for the entire training. They also offer like a prelim second year position. Now, again, this prelim second year has the same meaning as a prelim first year in the sense that it counts towards your training. It is the second year of your training. But again, you still need to complete the rest of the 3 years in order to be able to apply for board certification. So yeah, essentially those are the pathways after you do a prelim year. A tangent that I can possibly tell people about is that a prelim year also enables you to apply for some other specialties as well. It's not something that is exclusive to general surgery. So many a times there are some advanced programs, say for example, anesthesiology, interventional radiology, even ophthalmology, which is not a part of the NRMP match. All of these require you to do a prelim year and then you apply to an advanced position. So a prelim year is almost like a gateway to many specialties, including general surgery.
Right. So I think, a lot of people always have questions about that. And would your recommendation be, if a person's interested in surgery, for example, to therefore search for both prelim and categorical? And the next question that they'll have is, if both programs exist in the same location, do they apply to both?
When you say exist in the same location, you mean like at the same institution?
Correct.
Right. So yeah, I would cite my example. I applied to the places that only had a categorical position. I applied to those as well. As far as places which had a preliminary position and a categorical position, I applied to both. It's essentially just when you're actually on the ERAS website, when you're selecting the programs, you can literally just select if you want to apply to a categorical. You just have to click a checkbox like it's categorical, prelim, and I would definitely recommend that you apply for a prelim as well, because again, it's essentially like a foot in the door, and how you perform over the year. First of all, that people don't really realize is that a prelim year counts towards your US clinical experience. And that's one of the biggest things that non-US grads lack. This counts towards, this is essentially 1 year of paid US clinical experience, and you are getting paid. It counts towards your training. And all of this is going down in your CV. So say, for example, I can give you my own example right now, because I'm preparing for the subsequent match as well, the match 2021 for a categorical. So all of the rotations that I'm doing, I'm right now on my second rotation. I'm individually citing each and every rotation as to who my supervisor was, as to what I did during the rotation, and all of this is going to count towards my US clinical experience. So I would definitely say, for people who are interested in surgery and like hyper competitive specialties such as plastics, ortho, to have a look at prelim at least. Like, I know that there are many people out there who say it's just impossible to get surgery and yada yada, but there are ways and there are people who are doing it.
Absolutely. There are people doing it, and there's graduates who have moved on and done fellowship and other great surgical subspecialties, even after general surgery, who are IMGs. Absolutely. I agree with you 100%. I think, even on this podcast, we've had few surgeons in the past and you and some others coming up as well. So we know that this is possible because you're showing us how it's possible. Yeah. So, a lot of times IMGs, they want advice. They want advice as to, preparing a competitive application packet, especially this season. Seeing as you'll be going through this again the second time, like how many programs did you apply into? How many programs do you recommend is good for surgery? And any other tips that you've learned along the way about preparing a surgical application?
Right. So let me give you a comparative analysis because I think simply because I have the experience of going through to like in the process of applying for a second match and having applied previously as well. So last year when I applied for 100 general surgery programs and 185 internal medicine programs. I got 2 interviews for prelims, general surgery, that was at University of Miami-Jackson and University of Minnesota. And I got like 2 interviews for internal medicine. At that point in time, my application, my letters for surgery were specifically from surgery. My letters for internal medicine last year were from internal medicine or a subspecialty of internal medicine. And finally, my whole application it wasn't very one-sided. Like I didn't want it to sound like I didn't want it to sound to a program director that, hey, this person who's applying to our internal medicine program has a lot of surgical experience and something like that. Or I didn't want it to make it sound like, conversely, for a surgical program to, hey, why does this person have so much internal medicine experience, right? So it was like maybe cut down in the middle. It was a little bit neutral, I would say. But then over the course of applying last year, I really felt, first of all, like the total number of interviews, 4, right, is not a huge number, and it's not a very comfortable number that you can be like, hey, this is a very good number and I'm happy with it and I'll definitely match and blah blah blah. There's obviously so much downtime that you have while you're applying that your brain tends to wander into thinking like, what if I don't match and stuff like that. So one of my mentors essentially said, like, prepare for the worst. And at that point in time, when he said that, like, I did feel a little bit bad that, my mentor is saying prepare for the worst, that is not matching. And it was, but during that process, I realized that if I didn't match, I knew what I had to do, in the sense that I would have done more research. I would have done probably more observerships because I was already a graduate at that point in time, and try to just make my application more towards surgery and try to publish as much as I can, and maybe try to make some more contacts in the US. So this was essentially what happened last year. Now this year, in comparison, I plan to apply to around 120 to 150 general surgery positions. This year, I'm only planning to apply to a categorical position, simply because my application also includes the fact that I am a prelim intern in US itself as of right now. Other than that, I'm leaving out some stuff that makes my application a little bit more neutral and gives me, like, I'm not leaving out US clinical experience, but things that I did that were not so surgically oriented. I'm
Right.
trying to leave them out and, make this application look like that, a complete package for surgery only. And one more thing that I need to mention here is that last year I had like 2 different personal statements. One was for internal medicine, one was for surgery. This year I'm going all in with, again, just one complete package, one complete personal statement, just aimed towards surgery.
Absolutely. I think that you've laid it out for us. Strategy is very important in this process. Targeting your specialty with experience, with letters, with clinical experience, even just how you lay out your application portfolio, because every part of your application speaks for itself, guys. Like, all the experiences that you put in, the presentations, the posters, the research, all that speaks for something. So if it's, like the colors of the rainbow, we've done something in every specialty, then maybe you're a primary care person, right? But if you have, an application that is focused on one specialty, you have a higher likelihood of actually really showing proof of interest in the specialty. Absolutely. So did you do any research, Dr. Chan? Like, can you talk a little bit on that?
So I did do a research, but it was in India. So after I graduated back in 2019, early 2019, and before taking my Step 2 CK in August 2019, I was working at a postgraduate institute, like a teaching hospital in India. So I was working there for around a fair share of like 7 months. And it was at that point in time that I was also involved in a research. So it was a prospective cohort study that we were doing. And we had a primary endpoint of like 3,000 patients. It was regarding STEMI, ST elevation MI. But again, this is one of the questions I guess people do tend to ask. Like, yes, it helps. It definitely helps to have research and publications in the specialty that you want. In my case, I did not have that research in the specialty I wanted. I did not, my research was in STEMI. It was not in surgery, right? But with that said, obviously, some form of research does help. And it doesn't even have to be in the US. Ideally, if you have research experience in the US, it really does help, because it gives you connections to physicians who are already working there. And again, from that comes a potential letter of recommendation, stuff like that. But if you don't have the luxury of applying for a year of research in the US, or you don't have the financial power to fund yourself, if you can't find a funded position or something like that, then I would definitely say, just if you're in medical school, if you're just graduated, try to get a hold of professors that you have worked with, professors that know you, and just try to ask them for help, because most of the times it's like professors have a lot of they have seen so many patients, but they might not have so much time to sit and write down a case report and just a case series or something like that. And in those cases, you can help. You can show your interest and be like, hey, I want to do this, I want to help. And they can obviously guide you. And when you have people guiding you, I think it does help when you're eventually trying to publish. So I eventually published the design article for this research that I was involved in back in October 2019. I did include it on my ERAS application, but that was the only research experience. And in conjunction, that was the only research publication that I had on my ERAS application.
Yeah. Thanks for pointing that out, because I think sometimes IMGs, we feel like we have to have the best publication in the New England Journal for it to count. There's that misconception, when indeed your best research is probably going to come out after you become a physician that's training and involved in deep scientific research, right? That's when you
Right.
produce your best papers. The whole point of going to residency is to learn how to do the best cutting edge research that there is to be done. So really, prior to going into residency, then your focus should be on understanding the general concepts around research. And they're really not asking you to have been the first author on the randomized controlled trial, or, the one that created the meta-analysis. That's not what they're asking for. They're asking for evidence that you understand how to create a randomized controlled trial, because you have done some other kind of publications in the past. Because their goal is to train you in the way that you should go, right?
So that is something like, again, you don't have to do a randomized controlled trial. You don't have to go into like a massive research and like trying to figure out the vaccine for COVID-19 and publishing that or something. But a simple case presentation, simple case reports. There's like, I can talk about India, and India has so many diseases, like TB is so common, and you have all these patients that present with an amalgam of so many different presentations, and you can do so many case reports on that. You can also, one of the other easy things to do is like doing a review article. And review articles, you're essentially just analyzing all the data, or all the literature that is out there on us on a particular subject, and trying to refine it and just giving your opinion about it. So all of these are smaller projects that can be done if you just sit down and focus for maybe a few weeks, and you can churn out a publication. And obviously, if it's good, you can publish it in international journals. It doesn't have to be the Lancet, or like you said, NEMJ, but as long as it's PubMed index journal, as long as it is out there for people to be able to search about it and read it, I think it's a good deal. It's a fair trade.
Absolutely. I agree with you 100% on that as well. So, before we let you go, we want to get some advice from you because we're going to suck it all out of you today. We want to hear what you have, any word of encouragement for anybody that's looking at this and saying, wow, how did he do it? Right. Because, I'm sure you did this as a non-US IMG is my assumption. I may be wrong.
Yeah.
So, doing it as a person that's on a visa, and, that seems to be one other area that we find to be a limitation, or we think is a limitation, because I don't think it always is, but it definitely reduces the number of programs that we can apply into. But still, we get a good shot at all the university programs. Any final words of advice for that non-US IMG, or even the US IMG who's like looking at this thinking it's a long shot away?
So I would like to say, like, first of all, you need to find as to what you're passionate about, something that you really want to do. And when I say, for me, I found midway through during my previous application that when I was like, when my mentor said, prepare for the worst, that was the time that I realized that the worst is that I won't match. And what happens when I don't match? Would I just give up? Would I just change my specialty, apply for, say, family medicine or something? I was like, no, I'm too hard headed to not try to get what I really want. So if you really want, say, general surgery, if you really want radiology, if you want orthopedic surgery, it's going to take some time. It's going to take more effort on your part. It's going to take a mammoth amount of effort. But with that said, it's not impossible. And as long as you have that sustained effort that you're putting in consistently, I think you can make it through. And obviously, there are many things that might happen. You might not have the best score. You might not have research experience. You might not have contacts. But you have to make the best out of each and every situation. Like, no two applications are identical, right? But you have to make the best out of each and every situation. If you're on your electives, make sure that they're noticing you. Make sure that you outshine each and every other person that is there. Each and every opportunity that you have to interact with a physician in the US who might be able to give you a letter, who might be able to, nudge your name forward, that physician, treat all of them as an interview. You have to put your best foot forward. You have to make sure that you're doing everything that is within your capability to set you up on a pedestal. And even if you have any setbacks, just keep pushing forward of something or the other. Like, where there's a will, there's a way. That's the saying, right? So just keep on pushing forward, and things will fall into place. Even right now, like, I stand here like with a prelim position. I don't know what I'm going to be doing next year if I don't match or anything like that. And with the restrictions with the visa and everything considered, obviously everything might seem daunting. And even for a person who's applying for the residency this year with COVID and everything, you may not have as much US clinical experience as you want, and it might seem daunting. But the fact of the matter is, just push through, and make it's not just you who's in this position. There are thousands of other people who feel the same way, who are in the same boat, who are trying to pursue their dreams. Just push through, and just try to make the best out of each and every situation.
I honestly wish you the very best with the categorical slot that you're looking for. And I'm sure that with, the advice that you're sharing with us, I can tell that you have applied this in your own life, hence you're here now. And I really strongly hope that this opens up doors for you as you apply into categorical. I have a strong feeling that you will get in.
Thank
I
you so much.
I really don't have any concerns there personally. You just have to do it to submit the application and get the interviews. But from learning from you today, I think you'll make a great surgeon, and nothing's going to come in the way of that. So
Thank you so much.
thank you for joining us today and for sharing such truth with us, even in the midst of it, because you're still walking it. You're still in the middle of it all, but here you are giving back. So we really appreciate that.
Thank you so much for having me. It's really been a pleasure being here, to be able to just tell people that, hey, do something, like don't give up on your dream. I think, because again, surgery and all, some other specialties are like that, like wherein everyone just discourages you, and you're looking for someone to just be able to look at someone and be like, hey, if this person can do it with these scores, or with no research experience, or with minimal research experience, why can't I? So if this even pushes anyone who, say, is in med school right now and wants to be a surgeon in the US, I think it would have achieved its targets.
Right. Absolutely. I agree with you on that. And we really hope that we will send you well wishes, and we hope nothing but the best for you.
Thank you so much.